Okay, hi everybody, good evening. Can you hear me okay?
Everyone should be able to hear you.
Okay,
Okay,
so
you got some thumbs up in there.
got it. So this evening, I just wanted to have a discussion about COVID-19 cancer patients in general, as well as touch on a little bit how the vaccine potentially is used in this population, recommended, and efficacy of the vaccine in this population. Just to give you a bit of a sidebar, these slides are a bit complicated, so I'm not going to really go into depth on the slides. I'm just going to kind of just talk more as I go through them. So, if you guys have any questions, please, just stop me, interrupt me, and I'll answer whatever questions you have. I'd rather you ask questions for me to answer rather than just talk. Okay. So, all right. So let's just go to this. So the main question that, a lot of people are initially asking is, which type of cancer is the highest risk to have severe COVID infection? This has been studied in now multiple studies, and I think it's a really interesting question. And the answer to the study has come that the hematologic cancers like leukemia, lymphoma, have a higher chance of being hospitalized and have severe infection versus solid tumors. And I believe that the reasoning for this is because hematologic cancers seem to have a different sort of chemotherapy regimen, different immune system that's already impacted by a lot of these underlying diseases. And so then when somebody has exposure to COVID, they do tend to have more aggressive disease. And this next slide basically is explaining, again, just in a different graph form, that the disease is more severe in hematologic cancers, because you can see leukemia and myeloma are the top, and then it goes to prostate, lung, lymphoma. And if you look at the second point, there was a significant difference in age and severity and risk of mortality, whereas people in their 40s versus somebody over 80 years old from dying from the disease of COVID with cancer. So very much favored older population had a higher chance of death with COVID than the younger population. And these are all, again, this is all talking about patients with cancer. This is an example of basically how your body's immune system responds to the COVID vaccine. So if you see here, somebody inhales, oh, I'm sorry, next slide. Keep going. Okay, sorry, I forgot to tell you to go before. So you inhale the virus, that's what this person with the lungs, and then based on how much virus titer is in that exposure, that basically predicted severity versus a mild case. And these different pictures and so forth just show that and confirm that those with high virus titer ended up having a more severe response and required ICU admission, as well as septic shock and increased risk of death. So another high risk situation for really any patient is how much virus was in that exposure. And it's impossible to tell, okay? We have no idea whether you're exposed to somebody with low or high viral titer. So that's why mask wearing is extremely important for any patients, but especially cancer patients. And then this is just a summary slide stating that, patients with cancer, may already have impaired immune systems due to their underlying treatments, which will lead them to become more vulnerable to acquiring infection. And I'm sure everybody knows about drugs that are called immunotherapy. And the most common immunotherapy drugs are what's called checkpoint inhibitors. These drugs like Keytruda, Opdivo, Tecentriq actually increase your immune system. So the next question that I just kind of wanted to discuss with everybody is, how did this new class of drugs, which I would say probably more than 50% of my population is on, how does that affect the response to infection, the virus, the management, as well as those who getting COVID-19 vaccine? So I just wanted to talk a little bit about immunotherapy. So can you go to the next 2 slides? This always tends to be a hot topic. So why immunotherapy? Why are we also concentrating on this class of drugs so much now? Well, we're trying to take the immune system and kind of refocus it to recognize and attack cancer. And if we can do that, we can kind of create in our body what's called an immune system memory, and then maintain a response where the body does not progress. I mean, I have patients on immunotherapies really for years, and they are doing very well, but not everybody responds. About 1 out of 3 patients will respond. So another question that a lot of us are asking is, well, how do these patients, do they do better with exposure to COVID? Do they do better when getting the vaccine? Because we are stimulating their immune system. Next slide. You can go to the next slide again. So this slide is very busy, but I just wanted to give an update on how many immunotherapy drugs we currently have. There are 8, and they're all listed here. And you can see that there's basically approval for almost every subset of malignancy that we do have now. So they're used widely. Like I said, I would say probably, at least 50% of cancer patients are on one of them. Next slide. And to the next questions that people have been asking is, are patients who are on these immunotherapy drugs, are they having more severe COVID-19 outcomes or not? It seems to be mixed. Some studies are showing that patients who are on immunotherapy with cancer and they get COVID do have a worsening outcome. And some studies are actually showing that those patients do not have a worse outcome. So it seems to be a little bit mixed. But I think really the reason is because the earlier studies were pre-vaccine, and the later studies, which are more favorable, were with vaccine. Okay. Next slide. And then I wanted to just kind of comment about, now some of the vaccines that are out presently. So we all know that these are the different companies that are currently FDA approved in the United States for vaccine, with Pfizer, Moderna, Janssen, and AstraZeneca. Next slide. And one of the biggest studies that was done with looking at cancer patients was with the Pfizer vaccine, and specifically looking at those who were on immunotherapies. And the overall outcome with the first question were sort of adverse events or more symptoms related to the disease and more symptoms related to the actual drug. Because as we're stimulating the immune system, for patients that have the vaccine, are patients more symptomatic because we're stimulating the immune system? So are they getting more side effects from the vaccine? And actually it showed that there was actually there was no exacerbation or no increase in adverse events of the vaccine with patients who are taking these immunotherapy drugs. So it was relatively the same. We can go to the next slide. There have been a couple of issues, documented, as we've all heard, about different low platelet issues, specifically something called ITP with the vaccine, more with the AstraZeneca versus others. So it's just something just to be aware of, knock on wood, I haven't seen any personally, but there have been. So those are one of the side effects that we're seeing, not only in cancer patients, but in all patients. Next slide. So This is actually a really good slide summary that kind of states what COVID vaccine recommendations are for all cancer patients. So if you see here, this box, you'll see patients with solid tumors and timing of vaccine. So those who are on standard chemotherapy, the recommendation currently by our national guidelines is when it's available, when somebody can get the vaccine. For immunotherapy drugs, when it's available, and for radiation, when it's available. So there really has not been an overall, recommendation to say, no, don't get it during chemotherapy, don't get it, because the problem here with cancer patients is, I'm not sure if you guys are aware of, but when you're on chemo specifically, your immune system is hit. So some patients do make a response to it and some patients don't. Hence, they put in the booster shots. So we can measure our antibody titers, and that's how we can follow as to who has some sort of, unnatural immunity to the disease. So what I'm currently doing in my practice is I'm trying to wait a little bit and not give it specifically during chemotherapy. And I'm trying to wait until after chemotherapy. That tends to be what the overall consensus is amongst everybody. So even though what this says, the timing of COVID vaccine is when available, quote unquote, it really kind of means, what each kind of leaving it open to what the doctor thinks is best for each patient. And there are certain specific reasons why one would want to delay and or give during treatment. And those specific populations would be, bone marrow transplant, definitely you'd want to delay. So, it's just a real conversation between the doctor and the patient as to when is the best time. Next slide. This was another guidance for the COVID-19 vaccine, specifically for patients on immunotherapy. And overall, it's being recommended that, again, everybody should get the vaccine. There's nobody who should not get the vaccine based upon whatever drug that they're on. That the benefit of the vaccine outweighs the risk. A couple different. If you want somebody who happens to know somebody who's on immunotherapy, and if they have interest in learning a little bit more about immunotherapy, this is a couple of different options you can read about and look online and Google about. I'll stop there for a second and see if anybody has any questions. I know it's very confusing. So I think if anybody has any questions, please ask. Anybody? I'm going to ask a question. Does everybody understand what I'm talking about? I guess not. Okay. Oh, good. I got a thumbs up. Thanks, Vincent. Okay. All right. So let's progress forward. So the next couple slides is a bit of a different topic. So this is sort of on the same realm, but the other ones are more about immunotherapy. This is more generalized to cancer patients. So go to the next slide. Okay, so cancer patient management during the COVID-19 pandemic. So just to give us some background. So as an oncologist, when shit hit the fan, basically in March of 2020, many of us were quite concerned about treating patients with chemotherapy, with whatever drugs, new patients, old patients, because we did not know anything about the increased risk, decreased risk, worsening or severe disease associated with getting COVID. Will cancer patients die earlier? There was no data. No data came out till about 9 months into the disease. So now that it's been over 2 years, which is insane that we have been living in this new world, we have a lot of new recommendations. And, obviously all of us oncologists have lived through this with our patients. And fortunately, cancer patients have really done very well with COVID. So this is just some basic generalized information. There's overall no data or reports that show that cancer patients have a higher incidence of COVID-19 versus non-cancer patients. And then the discussion of starting chemo, not starting chemo, needs to really just, be discussed amongst doctor and patient. So can the patient be off of therapy? Can they start therapy? Do they have active disease? Do they have stage 4 disease? And then all patients, of course, have to, have appropriate hand washing, avoid crowded places, wear a mask, and so forth. Next slide. So, I think that what has happened, amongst the local hospitals in this community, as well as throughout the country, is they have quarantined certain floors for specific COVID patients as well as cancer patients, because we don't want to have cross-contamination and we want to keep our cancer patients as safe as possible. So some hospitals actually have COVID cancer wards, and some hospitals just have cancer separate and all of COVID, of course, separate. But it's important for, hospitals to be aware that patients with cancer who are coming in for complications of cancer, are heavily protected with appropriate, PPE. Next slide. So in cancer patients, there's certain risk categories. Patients receiving chemotherapy, patients on radiation, bone marrow transplant, hematologic cancers like leukemia or lymphoma or multiple myeloma, and any cancer patient that has the typical COVID symptoms, fever, sore throat, loss of taste or smell, that needs to be immediately addressed to their physician. Next slide. And then, of course, the recommendation is you do the PCR test, and if anybody tests positive, then we have to discuss whether or not it's safe enough based on severity of disease to continue. What's been going on, that what us oncologists have been doing is, if somebody does acquire COVID, we are holding treatment because, again, these patients are immunosuppressed, and then we are waiting the appropriate amount of time, if feasible. Each cancer is different, and then restarting at least 2 weeks or so once they had a diagnosis of COVID-19. So it's really a very individualized discussion, but it's definitely a treatment hold, because we cannot risk the patients developing more severe disease by making them more immunosuppressed with the virus. Scroll down. And this is basically kind of what I just had a conversation about. It's, do they have symptomatic disease versus not? And we have to have kind of a risk-benefit discussion about what we think is best. Back in the beginning of COVID, a lot of our patients who we didn't think needed or definitively required to start treatment immediately, we kind of put on a watch and wait basis. And as you all know, surgeries were put on hold. So a lot of patients ended up presenting with more advanced disease for the first year and a half with COVID during the COVID shutdown than should have. So there's been a lot of disruption to the medical system. Next slide. Obviously, cancer patients with fever. So every hospital or healthcare facility has their own policy. We're not going to have the patient who has a COVID positive case enter the office. The hospital is a different story, but they have to be quarantined. They have to have a 10-day clear period, and then they can come back in and be evaluated to restart treatment. So this is just another summary slide, sort of as to what we just kind of talked about. ESMO is a very large oncology academic group of specialists that came together and brought out a different priority system as to who would best be appropriate to continue with treatment versus low priority would be to watch and wait for a bit. So this is kind of how we are addressing or have addressed our cancer patients during the COVID-19 era: high priority, medium priority, and low priority. I'm going to stop there and just ask if anybody has any questions currently. Okay. Next slide. And the next slide. So, in case anybody just wants any more recommendations based on ESMO, you can, they have a lot of great patient-centered information. This happens to be the European Society of Medical Oncology. A lot of it is equal to what we have in the US. So it's a really excellent resource.